Study session number 3. Nutritional counseling. Hi Natalia, how are you today?
Hi Alessandra, how's your break?
It's good. How's yours?
Good, back to studying now.
Yep.
So chapter 28, nutritional counseling. Alright, let's get started.
Okay, so let's talk about the BMI.
Alright. So now, since we have the new charts, we have to question clients' height
And weight.
and probably roughly estimate their BMI and see if it's within a normal range or not.
Okay, so normal range is, after you do the BMI calculation, it's between 20 and 25. Underweight is under 20, and overweight is 25 to 30, and then obese is 30 or higher. Okay.
I thought, some books it's 18 for...
Yeah, underweight.
Yeah. Okay, so nutritional deficiencies are important to detect. What's the most common one that we ever see? It's usually scurvy,
Yeah.
vitamin C,
Vitamin C.
vitamin B deficiencies,
B.
where it's a red glossy tongue
Yeah,
appearance.
that's from B12.
Yeah. And
The
then,
beefy tongue.
yeah, and angular cheilitis, usually vitamin C.
Okay, so
So we can actually recommend or create a new diet plan for any of our clients.
we can say that you need more vegetables, more fruits, more grains, stuff like that, but we're not allowed to actually.
No, and it's mostly for them to reduce their risk for caries.
Okay, so if there is a lack of vitamin A, the deficiency is oral implications. So let's go over some oral implications.
Yeah, actually, this is good for boards.
Okay. So vitamin A is reduction in formation of the ameloblast and odontoblasts. Oh no. Vitamin D is enamel hypoplasia and loss of the lamina dura.
Vitamin E is vegetable seed oils widely distributed in foods. Deficiency is anemia, neuropathy, myopathy, enamel hypoplasia, and loss of lamina dura, loss of resistance to inflammation, and periodontia. May be involved in bone formation. And excess may cause vomiting, diarrhea, hypercalcemia. Excess may inhibit vitamin K functions, causing problems with blood clotting. So we want to be careful in treating patients with vitamin D deficiency. Right, so then there's the vitamin B.
That's what we were just reading.
Right. So,
Vitamin K.
Vitamin K.
Okay, so deficiency is defective blood clotting. So oral implications, it could be maybe involved in bone formation. And then vitamin C is obviously scurvy, and it inhibits the formation of fibroblasts, osteoblasts, and odontoblasts.
Calcium, really important, found in milk and milk products, sardines, clams, turnip, and mustard greens and broccoli. Deficiency, you probably notice rickets, osteomalacia, osteoporosis, scurvy, stunted growth, tooth exfoliation due to osteoporosis and alveolar bone, and excess may cause constipation. Phosphorus, found in meat, poultry, fish, eggs, milk products, chocolate. And deficiency syndrome is rickets or osteomalacia. Possible failure of reparative dentin formation. Symptoms associated with excess are rare. Problems appear to be or occur only when calcium to phosphorus ratios are altered significantly in infants.
Okay, so let's go over some of the most common B deficiencies,
Yeah.
which would probably be B12, right?
Yeah.
Okay, so you can get B12 from meat, fish, shellfish, poultry, and milk. Okay, so in the oral implications, you can get glossitis and eventually disappearance from the filiform papilla.
Yeah. So those are the important vitamin B, complex vitamin B.
Iron.
Oh yeah. So organ meats, clams, oysters, legumes, enriched and or whole grain cereals, and breads. Deficiencies, fatigue, palpitations, or exertion, anemia, decreased resistance to infection. Sore tongue, angular stomatitis, dysphagia. Excess causes damage to tissues, including liver and or other organs.
Okay. So,
So always have a balance of all the 4 food groups
try to follow Canada's food guides.
according to your age and gender.
Okay, so let's go over some legal, ethical, and safety issues when it comes to nutrition.
Yeah.
So dental hygienists should refrain from going out of their scope of practice. So that's by not prescribing and by like not making a full meal plan for them, because we are not nutritionists.
We can't recommend any supplements or anything like that.
Read the next one.
Clients need to be altered to potential signs and symptoms of nutritional deficiencies and refer to a physician for a diagnosis.
And always document whatever you tell them. So like if you say you should try to eat more fruits and vegetables, always make sure it's documented.
So you've informed them.
Yeah.
Okay, so
Do you have any questions about nutrition?
no, and if we do, we can always go back over and just repeat it, right?
Mm-hmm.
Okay, so that's done. Let's move forward.